Hi, my name is Emily. I'm a yoga instructor and massage therapist, and today I wanted to talk to you about how you can request certain things from your massage therapist as a hypermobile person. Now, whether or not these things apply to you is very individual, so you make the call and maybe speak with your doctor about what's appropriate for your body and not. It really depends on the severity of hypermobility that you're experiencing in certain joints and any injuries that you might be dealing with at the moment. Massage can be a great way to reduce pain and increase blood flow to really tense, tight muscles that hypermobile people tend to have. So, when you're booking your appointment or when you're speaking with your massage therapist, let them know ahead of time that you are hypermobile. If they seem like they don't really understand what that means, or you're feeling cautious and you want to let them know exactly what you want or don't want, let them know these three things. Number one, no stretches. Massage therapists often incorporate stretches to help mobilize certain areas or lengthen certain muscle tissue. Here's an example of a calf stretch. I am passively moving my client's foot into dorsiflexion to stretch the calf muscles. Because of your hypermobility, it's very possible that those stretches are just lengthening your connective tissue instead of lengthening your muscle tissue. So you can always ask for no stretches. Number two, no traction. This is especially important if you have joints that tend to subluxate. I think that's how you subluxate, right? Subluxate, or even dislocate. Traction is not going to be your friend. Traction is basically when you're pulling one body part gently away from another, and this is often done right before a stretch. Traction is usually incorporated between a range of motion and a stretch. So for that calf stretch that I did earlier, I would probably do some range of motion first, and then I would traction the ankle before stretching it. Number three, limit BMTs to your unique needs. BMT stands for Body Mobilization Technique, and this is when a massage therapist moves your body for you, so not stretching, but moving your body in a certain way, and perhaps sometimes incorporating a massage technique into that movement. Sometimes this can feel really great, but if you have any sort of limited range of motion or an injury of any sort, and this goes for anyone, not just for hypermobile people, please let your MT know ahead of time. So any sort of movement that bothers you, for example, my right shoulder is injured and bringing my hand behind my back is not a great feeling. So I would let my massage therapist know ahead of time, hey, please don't put my hand there. I don't want any sort of BMTs on my right shoulder. BMTs are generally done in a normal range of motion. So in this one, I am pressing into the tissues of my client's foot while mobilizing the ankle. On the other hand, I'm dealing with shoulder injury. So while this BMT feels really good on my left arm, I really don't want my right arm being moved in this way. And lastly, I know I said there was three, but this happens before you're booking your session. Reconsider deep pressure. You don't have to book a deep tissue massage in order to feel better. Now, because we're hypermobile, muscles tend to tense up and get really tight and hypertonic. They can almost feel numb. And deep pressure sometimes is the only way where you can actually feel something in that area. Trust me, I totally get it. But keep in mind that those muscles are tightening up for a reason. So if those muscles are holding you in place and you get them relaxed through a deep tissue massage, notice how you're feeling after the session, like the rest of the day or the day after, and see if you're feeling better or worse. If you notice that deep tissue is not really doing it for you in the long term, consider a medium pressure massage. You can ask for medium pressure in deep tissue. You can ask for medium to deep pressure in a Swedish massage, which is more focused on relaxation and just blood flow. Or you can try a massage that has minimal pressure, something like lymphatic drainage or craniosacral therapy. Those things can be really relaxing and help put you in a parasympathetic state. I hope these tips help you communicate with your massage therapist the next time you book your session. Please let me know if you have any questions. I'd be happy to help as much as I can, and I'll see you next time.